take off. So the facet replacements have been something we've been knowing about for really almost 20 years. Initially, we had 3 devices that within a period of a couple of 3 years started to be studied. The first was the first generation tops and the TFAS in the Facet Solutions Acadia. I was involved in 2 of those studies. Unfortunately, the metal on metal of the TFAS and the Acadia devices led to those not being utilized any longer, and so TOPS then rebranded itself, did a Gen 2, and started an FDA study in 2017. And that was 302 subjects. It was originally designed to be 500 patients, and they were going to do interim analysis at 300 and 400 patients, and when they did this 300 patient analysis, it showed superiority and stopped the study. The primary endpoints, the key inclusion criteria were L2 to L5, and it was degenerative spondylolisthesis with moderate to severe spinal stenosis. The exclusion criteria is BMI greater than 41, only one level, and had to have at least a 4 millimeter disc space. When you look at the demographics, there were matched between the 2 groups. Interestingly enough, this is an older group, and also the surgery times were no longer than for the TOPS than it was for the fusion. There were 6 primary endpoints that went together to create a composite endpoint, and you had to have no re-ops, lumbar, no injections, ODI reduction of greater than 15, no new or worsening neural deficits, no major device AEs, and no fusion status changes. And when you looked at that composite point, it was statistically way different between the 2. Now, the FDA showed that, but then one of the driving factors was the actual fusion status. And some people say, well, what if you pull the fusion status out? Well, you pull the fusion status out, you still get 53 to 78, statistically significant at 0.0035. And again, the FDA said there was a significant advantage in TOPS over fusion. You look at ODI, you look at back pain, leg pain, and then looking at range of motion. Obviously, the fusions don't move, but it's showing good angular motion with the device. And then also with translation, there was a physiological post-op translation regardless of the pre-op stable or mobile spondylolisthesis. Now everybody says, what about the surgical interventions and complications? Most of those were non-device related, but when you look at the overall complications, it's 5.3% for TOPS versus 8.5% for the fusion. So the US IDE summary said that it's a clinically effective solution for spinal stenosis. It did maintain motion at the index level and demonstrated superiority at 24 months versus a TLIF. Now we're making all sorts of questions, which actually they're good questions, so I gotta admit that. But at some point, data is data, and regardless for the patients that you have in your office that are indicated by the inclusion-exclusion criteria, it did better than a TLIF. Now, there's arguments you could say, well, that I would do a lateral, which I think does better than TLIFs. That's true, so that's not tested, but the data is the data, and I'm interested to see longitudinally how this works and if there are any issues down the road.
The one thing I'll say honestly is TOPS did get FDA approval, unlike any other posterior pedicle-based system to this day. So that has something to say to it, good or bad, when we know every other system failed. So right, we'll see by time, but that I will have to give it to them. They got approval, which is really good.
And I'd also make the comment about, nothing makes you more humble than your own, looking at your own results. And so it's just like when I work a lot in the cervical field and getting ready to do the FUSE data, which is a 3-level ACDF versus posterior backing it up. And everybody thinks the 3-level ACDFs do well. Well, when you dig down into it, it's not as great as you think when you follow up on 98% of the patients. So I think the same is true of the TLIF, is that people think, oh, my TLIFs do great. But when you really start digging down the data, and they could use Medtronic or DePuy, whatever they wanted to use for their TLIF, they weren't really, whatever they wanted to do, and the results are the results.